Hello, Dr. Mulholland coming at you from Orlando, Florida. The last weekend of 2024, bringing to you the biggest thing that's going to hit aesthetic medicine in 2025, which is single session, side office, under local, significant fat destruction in one treatment. Kind of like we always wanted cool sculpting to be, but it never was. So hands-free, yeah, that's okay. This is hands-on, but non-aspirational, and that is like basically the deep Morpheus. So let's take a look and see how that works. First of all, side office. So you're going to do this as a sterile technique in a clean environment. Sterile technique in a clean environment. This does not have to be done in your OR, your operatorium. It can be delegated, in my opinion, to any provider under medical legal liability, depending on the state. And you can do it in your side office. We're doing this in a Conrad. I would never do this at a Westin or a Sheraton. Conrad, Four Seasons, maybe a Ritz, and your side office. Okay, and so I always put my assisted visual device on because it looks impressive. And let's pull this down a bit. Now, we've already got her prepped a little bit, and let's get everything out of the way, roll everything down. And you can see where I'd already marked her out. Okay, so we've got a couple little bulges, and we're going to break them down into bite-sized morsels for our Quantum RF10. One area, which is going to be half of the pulse count of the whole area, or one hand, two hands, and a teeny-weeny palm. And so this was approximately 8 centimeter pinch, one hand, like the outer thigh, inner thigh, bra line, hip. Usually it's one hand or 10 by 15. That's going to be about 300 pulses, 150 in the deep level, 150 superficial, about 120 seconds. Then the other side, and then in a tiny little area, size of your palm, with about 100 pulses. Very simple. Now, we are going to go under the skin with something. So anytime I go under the skin, typically I give one antibiotic an hour before, like a cefazolin if they're penallergic, clindamycin, maybe a Toradol. That's it. That's it. You can use a little surgical pack that you might use if you're taking a mole off or a lipoma, and you want to square drape this either with towels or blue towels. You just want to make this nice, sterile technique in a clean environment.